What temperature should your house be at? Should your baby ever be sleeping at an angle? No. And how many layers should you wrap your babies in? All great questions and things that we're going to cover today. Hi, I'm Dr. Tala, and I've been a neonatologist for 17 years now. So I've had to discharge hundreds, if not thousands, of babies from the hospital. So today I'm going to cover kind of the usual spiel that I go through as we're discharging the babies. One, let's start with safe sleep. Basically, the most important thing that you could do to make sure that your baby stays safe is to make sure that your baby is also sleeping safely. The AAP, the American Academy of Pediatrics, released a policy statement a few years ago on their own safe sleep recommendations. So I'll link to those below as well. Let's run through those recommendations. A, no co-bedding. That means do not sleep in the same bed as your baby. Look, before everyone in the rest of the world or even in the US writes to me about this, just realize that in the US especially, there is a very high correlation between co-bedding and sudden unexpected infant death. The risk is that somebody rolls over and squashes the baby, or the baby literally rolls out of the bed, both of which can have absolutely tragic consequences. Maybe that is because we don't have a village here to help us raise these babies, and so all parents are absolutely exhausted. And as you all know, bad things happen when we're all exhausted. So I really emphasize this when parents are going home: no co-bedding. More than that, I encourage mothers to get out of bed when they're feeding their babies at night, just because they are going to be so tired. And so it's very easy to fall asleep again if you're just still in the bed. B, the baby, therefore, should be sleeping in a crib or in a bassinet in the parent's room. The AAP recommends that the baby stays in the same room as the parents for the first 6 months. I know this is tough because of life and work and everything. I try to encourage parents to sleep in the same room as their baby for at least like the first 4 months. C, the crib or bassinet should have a firm, flat mattress and a fitted sheet. Basically, nothing extra soft where the baby can like push its face up to and actually cause suffocation. So firm, flat mattress and a fitted sheet. D, put the baby back to sleep, i.e. the baby always sleeps on his or her back. This is probably honestly the most important aspect of safe sleep. Do not put the baby on their side or on their belly, only on their back to sleep. E, and this kind of goes back to what we were saying earlier, make sure that the baby always sleeps flat. So the bed itself needs to be flat, not propped up. It needs to be at a less than 10-degree incline. Some parents think that maybe if we prop up the top of the bed and increase the angle, it will help with reflux for the baby. The problem is, though, is that babies' necks are weak. And so they also like to kind of squish themselves down. So it's very possible that if the baby is at an angle, the chin will kind of fall forward and block the airway. This is also true if a baby falls asleep in a car seat or a swing. If they do fall asleep, somebody should be watching the baby. If you're planning on sleeping, then definitely take the baby out of the angled seat or bed or whatever it is and make sure that the baby is sleeping flat. F, the baby should not be in a crib or bassinet with any blankets or sheets that they can put over their nose or mouth. Basically, try to keep the bassinet or crib completely empty of everything. So no burp cloths, no stuffed animals, no extra blankets, nothing. Some babies do seem to do better when they're swaddled. Some parents buy those sleep sacks, which can be great because there's no way that they can put any of the material over their faces. Just make sure that with those sleep sacks, they're not too constricted. Like, we want the babies to have some movement. Some of them, you feel like the babies are kind of like in a straitjacket, which can't be good for their physical development. When an infant starts exhibiting that they're able to roll or they're beginning to roll over, it normally happens at 3 to 4 months. It can happen before that. Then you should no longer be swaddling the baby. We don't want the baby to be swaddled and then kind of flip over onto their belly and not be able to move. So once a baby is starting to roll over, stop swaddling them tightly. If you can get the baby to just sleep in a onesie and some pajamas, then that's fantastic. So no swaddling, no blankets, no sleep sack or anything. That's obviously a lot easier. G, don't let the baby be anywhere near smoke. So secondhand smoke, as you all know, greatly increases the risk of SIDS in babies. No smoking in the house. Try to avoid it altogether. And H, offering a baby a pacifier actually, if anything, may be helpful in reducing the incidence of SIDS. So I know that this makes parents very nervous because the baby's actually putting something in their mouth, but the studies that are being done, which aren't great studies because it's something that's very difficult to study, have shown that if anything, it may actually reduce the risk of sudden infant death syndrome. 2, let's talk about feeding now. Before the baby actually leaves the hospital, we need to make sure that the family feels very comfortable being able to feed the baby, whether it's breastfeeding or whether it's bottle feeding. Babies need to feed often, every 2 to 4 hours. So basically, babies are feeding 8 to 12 times a day, which is a lot. Parents are always worried that their babies are not feeding enough, or they're not going to be able to tell whether their babies are getting enough food. Basically, if your baby has episodes of being active and alert and wanting to eat, and the baby is having wet diapers and pooping, and we'll talk about that later, and obviously the pediatrician knows that the baby is growing, then we can feel very good about how much the baby is eating. A good rule of thumb is that babies can drink half their weight in pounds in ounces. So, for example, if a baby weighs 10 pounds, then they can feed up to 5 ounces at a time. That's kind of like the maximum. They won't need 5 ounces every 2 hours or anything, but just so that you know, half their weight in pounds, that's what they can take in ounces. So if they are 12 pounds, then they can take up to 6 ounces. And it takes about a week for them to build up to that kind of like full volume feed that I just talked about. After discharge, babies should not be fed anything but breast milk or formula for the first 4 months of life. So no water, no rice cereal, no oatmeal, no 7-Up, nothing unless the pediatrician prescribes it. Only breast milk or formula. They're getting all the nutrition and fluids they need from those. 3, car seats. Honestly, this is one of the few things that you have to own before the baby goes home. Sometimes I think you need kind of like a PhD to actually figure out car seats. So spend a little bit of time getting used to your car seat. Generally, the lower limit of the car seats is either 4 pounds or 5 pounds. Obviously, if you think you're going to have a smaller baby, then definitely go down to the 4-pound one. As you all know, they are super important for a baby's safety. And obviously, all infants should be rear facing, so they're facing the back of the car, and they should be strapped in with a 5-point harness. It should be tight enough that you can just about get a finger underneath the strap. I would highly recommend that you really play around with your car seat before you put your baby in it for the first time. 4, baby's ideal temperature. As you all know, it is dangerous for babies to get either too hot or too cold. A lot of people ask what the ideal temperature is that the house should be set at. It's probably somewhere between 68 to 72 degrees Fahrenheit, which is 20 to 22 degrees Celsius. Even if that's not the whole house, then maybe just the room that the baby actually sleeps in. I actually always tell parents that a baby needs one more layer than what they're wearing. So if you're wearing a t-shirt, then the baby needs a t-shirt and pajamas or whatever. Same thing in winter. If you go out with 4 layers, then the baby needs 5 layers. So always be very aware of the actual environmental temperature for the baby. We don't want them too hot or too cold. 5, keep babies away from sick contacts. All babies, especially ex-premature babies, have a really weakened immune system. So it's really important to keep anybody sick away. If there are young siblings in the house, then let them touch the baby's feet, not the hands or the face, so they can touch and kiss the baby's feet. Hopefully that will help in keeping kind of germs away from the baby. We'll go over this again in a bit, but if the baby's temperature is above 100 degrees or less than 97 degrees Fahrenheit, then that could be very dangerous for the baby. And basically, you have to go straight to the pediatric emergency room. It could indicate a bacterial infection in a baby. So yes, we have to be incredibly careful about babies getting sick. 6, umbilical cord care. Basically, you just want to keep the whole area around the belly button as dry as possible. We used to put stuff on it to help that process, but now our goal is just to keep it as dry as possible. And then the umbilical cord stump normally falls off within a week or 2. So when you're putting on a diaper, make sure that the top of the diaper is underneath the umbilical cord. So if the baby pees or anything, it doesn't get that whole belly button area wet. Also, only sponge bathe the baby until the umbilical cord falls off. Obviously, if you dunk the whole baby into a bath, then that area is going to get wet and it's going to take much longer for that stump to fall off. While we're talking about bathing, this does not have to be done every day, maybe a few times a week, or if the baby's especially stinky. 7. What about stooling and urinating? Well, interestingly, stooling can be very variable in babies. A healthy baby can poop 8 times a day, or they can poop twice a week. So a lot of variability. As long as a baby continues wanting to eat and is not like excessively straining and crying out when they're pooping, then we really don't worry about poop at all. Also, as an aside, parents always ask about different colors of the poop. Again, we don't really worry about the different colors either. It could be yellow, green, more of an orangey color, a brown color. All of those are non-concerning. The only times we really worry about the color of baby's poop is if it's a whitish clay color. So if you do notice that, then make sure that you tell your pediatricians about it. Obviously, we would also be concerned if there's blood in the poop as well. And then what about the urination? Basically, healthy babies should have about 6 wet diapers a day, maybe even more than that. It takes about a week to reach that volume. But if you have, for example, a 2-week-old baby who's only having 2 wet diapers a day, then that is very concerning and you should be speaking to your pediatrician. So after a few days, think 6 wet diapers a day. 8, and then I always end with when parents should be concerned enough to take their baby to the emergency room. The most important thing I emphasize is a high or low temperature, so above 100 degrees, less than 97 degrees. Parents don't necessarily realize this because obviously we wouldn't go to the emergency room if we had a slightly high or slightly low temperature. I always really emphasize that the parent should trust their intuition. If the baby starts acting very differently, then they should be concerned that something is up. For example, if the baby is excessively sleepy, especially if the baby kind of becomes like a rag doll and doesn't really want to wake up for feeds, that is concerning. If the baby starts breathing a lot faster or is like working a lot harder, you can kind of see all the ribs and the skin move a lot more for the baby to breathe. Again, that's very concerning. Or the baby has a big cough. Remember, though, that babies do breathe a little bit faster than us at baseline anyway, so kind of get used to the baby's normal rate of breathing. If the baby looks really jaundiced, so that kind of like really yellow orangey color in the skin, especially if that is associated with the baby being sleepier, then yes, immediately go to the emergency room or call your pediatrician. If the baby vomits a green color, so a bilious color, babies vomit all the time, they spit up, we have burp cloths, we're used to that. But if it starts looking like it's an excess quantity or it's like a fluorescent green color, then that is very concerning. Or if the baby is crying inconsolably for an hour or more. Look, it's very usual for babies to cry. They can cry up to 3 to 4 hours a day. But normally when a baby is crying, there's something that you can do to kind of like temper that crying a bit. Whether they're hungry, whether you need to change their diaper, whether they want to be swaddled or held or go for a walk or whatever it is. If literally nothing that you're doing is stopping that inconsolable crying, then your baby is probably telling you something. I'm just going to add this here. I know that you all know this. Crying in a baby is not dangerous for the baby. So if a baby cries a bit and then can be consoled, it's not like the crying is bad for the baby's brain. Sometimes we all get super frustrated with the baby crying. Step away from the baby. Put the baby in a safe, flat space and just step away and calm down. Obviously, never ever shake the baby. Okay, that's roughly what I go over whenever we send babies home. If you got this far, then please like this video and let us know what sort of neonatal stuff you'd like to hear about next. Thank you so much for being here.